Okay, so I'm going to spend the next 15 minutes sharing with you some tips and tricks that I've learned from patients during the past few years, both through my clinical practice and through the charity. As Valeria and Nick have already said, in patients with POTS, there's often inadequate vasoconstriction when they stand up. They become relatively hypovolemic, and there's excessive pooling of blood in the abdominal cavity and limbs. So the treatments are often targeted at increasing blood volume, reducing this blood pooling, improving the venous return, and increasing the muscle pump, which helps to compensate for the pumping action of the heart. So I realise that some of you here today are quite new to POTS, and some of you are very experienced. So I'm going to briefly cover some of the basics and then perhaps move on to some less conventional measures. And the topics on the right-hand side of the screen, they'll be covered by speakers later in the day. So it's important for patients to maintain a very good fluid intake when they have POTS. And it's important to take a very detailed fluid history, because patients often think that they're drinking a lot more than they actually are in the day. And we commonly recommend that adults should have 2 to 3 litres per day, and more in a hot environment or if they're exercising. But some people can become a little bit over-enthusiastic about drinking, and you've got to remember that water intoxication can be a dangerous phenomenon, and this would result in hyponatremia. So in theory, an adult could drink 24 litres of fluid in one day if they didn't sleep and they just kept drinking. But the problem is that the kidneys can only handle about 1 litre per hour. So if over a few hours they drink more than 1 litre per hour, then they can become waterlogged. And there have been cases reported of healthy young men and women drinking 6 or 7 litres over a period of about 3 hours and becoming very ill or even dying. With children, their kidneys can obviously handle less, so you have to be even more careful with their fluid intake, and we would normally recommend that children drink fluids until their urine runs a pale straw colour. It's helpful to have a boost before rising in the morning, because people are often hypovolemic and a bit dehydrated overnight. And rapid water drinking is interesting. In an emergency, if you drink 2 glasses of water in rapid succession, within about 3 minutes in orthostatic hypotension, you can get a rise in the blood pressure, and in POTS you can see a fall in the heart rate. And this happens before the fluid even enters the vasculature and is thought to be a reflex, possibly due to stretching of the stomach. It can be useful to suggest that patients use sports bottles so that they can monitor their fluid intake. And there are some quite nifty little apps available, and they help patients monitor their intake. They'll remind them to drink, and then they sometimes get quite a fanfare when they actually hit their target for the day. I wouldn't suggest that you would recommend as much salt as the chap in the cartoon's having, but we would usually recommend about, in an adult, an extra 6 grams per day. And that's equivalent to a teaspoon of salt or 10 slow sodium tablets. But obviously you need to take care in patients with hypertension, kidney disease, heart disease, and again, children. And in children, we would normally recommend about 2 millimoles of sodium, and then that's a typo there, that should be 0.12 grams per kilogram per day in 2 divided doses, and then you can double that if necessary. Exercise has already been mentioned. Patients are often very exercise intolerant, and so we would recommend a very graduated regime, telling patients that they will take between 6 weeks, even 3 months to notice a difference, and that they very often feel worse before they get better. And it's often necessary to start at a really low level, and with horizontal exercise such as Pilates and swimming, recumbent biking, and rowing. Patients quite often find they struggle to swim, and I don't think it's actually the swimming that's the problem. It's getting out the pool afterwards and getting dressed and ready to go home. So it's quite useful after the swimming if they float by the pool, let their heart rate, by the side of the pool, let their heart rate settle, maybe sit by the side of the pool and then have everything ready in the changing room so that they can just get straight out and get home to a cooler environment. Some patients find that they can't actually walk slowly. It's almost like standing in the blood pools. So sometimes they find that slightly brisk walking is easier than slower walking. So you'll find that your patients will adopt quite a variety of dietary measures that seem to help their symptoms. And there's not been a massive amount of research into this area, and it's definitely worth exploring. But certainly having meals that are low in refined carbohydrates, often high in protein, high in salt, and having little and often seems to be very helpful. Sometimes patients will adopt several of these measures, and I think it's really important that they see a dietitian and that you make sure that they're not becoming deficient in vitamins and elements. And also it's important to review if they've changed their diet to see if it's actually helping, and if it isn't, that they should stop. Quite a lot of the treatments for POTS have been hijacked from orthostatic hypotension, and compression tights is one of them. And we often we usually would recommend waist high and class 2. But as you can imagine, these are younger women that we're asking to wear NHS prescription tights, and they're not always very popular. And for men, for obvious anatomical reasons, it can be quite difficult to find suitable compression. So some men find that the sports compression clothing, and some women as well, they find the sports compression clothing, such as Skins, is a lot more acceptable for them. And in answer to the question, is it ever really okay for men to wear tights? I think the answer has to be an unequivocal yes. Again, from postural hypertension, there have been postural manoeuvres adopted, and you can see in these slides on the left here that as this gentleman adopts these measures, his blood pressure is going up. But in POTS, the heart rate will come down as well, and patients often feel less dizzy. But you can do it a little bit more subtly. You could sort of, if you're having to stand in a lift, bend down and rummage in your handbag, pretend to tie up your shoelaces, or even just rocking up and down in your heels in a supermarket queue can help symptoms. Temperature regulation can be quite a problem for patients with POTS, and certainly dressing in layers so that you can sort of take them off and put them back on again is very helpful. Some patients will use ice vests, but they are heavy and their material's not very well ventilated, and obviously you have to replenish the ice, so it's not an easy option. And there is some sports cooling towels available very readily. You can get them in sports shops and on the internet. And if you wet them and then wring them out, they actually feel quite dry, but if you then drape them around your neck or over your shoulders, then as the water evaporates, they will cool you down, and they can be very comfortable in hot weather. There's some evidence that women with POTS experience exacerbations either before or during their period. And by rendering them amenorrheic without periods can sometimes help their symptoms. So I've found that using the combined pill, you can tri-cycle. So that means instead of having a 21 days of tablets and a 7-day gap, 21 days and a 7-day gap, you run 3 packets together and then have a 7-day gap, which means you only have periods 4 times a year, and that can work really well. And there is new evidence that you can actually run the pill packs together for the whole year and then just have 1 week's gap at the end of the year. And that seems to be safe, but it's not yet a licensed use for the combined pill. The progesterone-only pill and the implant and the Mirena can also cause amenorrhea, but they don't have quite as good cycle control as the combined pill, and occasionally women will experience unacceptable spotting and they'll have to stop it. And I found in my own clinical practice, when you fit a Mirena coil, women often feel a bit bloated afterwards and get a bit of fluid retention, and that could be quite useful in the context of POTS. Nobody really knows what happens to people with POTS around about the menopause, and certainly I've seen some patients feel a lot worse. And they ask me, and I get a lot of inquiries through the charity about HRT. We don't really know the answer to that. So with my patients, I would usually counsel them, see if they're suitable, tell them about the side effects and risks, and then if they want to give it a try it for 3 months and see if it makes them feel better. Some do, some don't. Travel can be quite challenging for patients with POTS. And there are apps available that can help them to plan accessible journeys, for example, avoiding steps. And the TfL in London and increasingly other transport schemes around the country are offering Offer Me a Seat badges and cards, and the patients will wear them, for example, when they're in the underground. And if they happen to be noticed, then they're sometimes offered a seat. Also in airports, there are lanyards available in most of the large airports in the UK, the Sunflower lanyard, and that identifies the patient as having an invisible disability, and it can help them with things like queuing. And in fact, in a lot of airports around the UK, there's increasing training going on of staff to help to recognise people with invisible disabilities. If a patient needs to sit down suddenly, then there are quite a lot of very, very compact and lightweight chairs available that they can carry around with them. And I've got a little selection of them down there if you want to have a look at them later. I mean, some of them will just fit into little bags like this, or even into your pocket. If everything fails and patients do have some sort of emergency, then it's helpful for them to carry ICE cards. That's in case of emergency cards. And we do have some available through the POTS UK website and shop. And also Hannah Ensor runs Stickman Communications, and that you can find quite easily on the internet. And she's got some super little cards and other accessories for people with POTS, with EDS, and with other invisible disabilities. Okay, so I'm happy to take any questions if anyone has any.